Hello, good evening, guys. Welcome to the live broadcasting of Eurocare, the online community medical support network. I'm Shireen. As a lady, over time, age and events such as pregnancy and birth can affect the internal and external structures of the vagina, causing changes in both its appearance and physical response to the stimulus. This always been an issue that bothering a lot of ladies out there. Today, with the advanced medical technology that we have, Cosmetic Gynecology aims to make improvements to either the physical appearance or functions of the vagina and labia. In many cases, both goals are achieved simultaneously. Today, I'm glad that able to invite the obstetricians, gynecologists, and urogynecologists, Dr. Anil Das, the healthcare partner of Erufu Care, to share about what is cosmetic gynecology and how it makes the lady feel wonderful again. Welcome, Dr. Anil.
Hi. Hi. Hello. Good evening. Thank you very much.
Evening. Before Dr. Anil starts, I would like to give a brief introduction for Dr. Anil. So Dr. Anil is a graduate from KMC Manipal in 1998, started his career in Ibo GH in the same year, went on to do master in Obs and Gynae in HUSM Kubang Krian, and graduated as a specialist in 2007. While working in Penang GH, Dr. Anil was inspired to continue subspecialty training in urogynecology. The training included 1 year attachment in Changbong Memorial Hospital, Taiwan. After 16 years of government service, he left for private practice. Now he is the consultant obstetricians, gynecologist, and urogynecologist at Bagan Specialist Center, Butterworth, Penang. No more further delay. I shall pass the session to Dr. Anil for his sharing today.
Okay, thank you very much. Thank you very much for the kind introduction. Good evening, ladies and gentlemen. Thank you. Thank you for coming in and watching this. This is my first session with Erufu Care. Okay, so now, today I'll be talking about a very interesting topic. I believe a lot of women will be interested with this. Okay, my tagline, we make women feel wonderful again. So first I will share the screen.
Yeah, sure.
Okay, so as I said, our aim is to make women feel wonderful again. So today my talk is about cosmetic gynecology. Okay, something a bit new. I want to introduce to you all and make you aware that there's something like this. Okay, so what is cosmetic gynecology? This is cosmetic gynecology is basically some procedures which are done to improve the appearance and function of the vagina and the labia. Okay, so basically it is a part of treatment for female sexual disorders. Some women have problem with sex, so it all comes under this. Some of the problems are like discomfort during sexual intercourse, which I will explain further. And also these ladies sometimes, morning when they get up after the shower, they look in the mirror, they put on their makeup and all that. It's not only their face appearance, sometimes the down also, they look down and then sometimes they are not satisfied. They're not satisfied with the appearance of the external genitalia. I've seen one plastic surgeon call it the second face, So, so that is where we are. That is where we are there to help. Okay, to make the appearance look better. So basically, it is to look good and also feel good. So all these things I will explain. These two things. The most important is to look good and to feel good. Okay, so we make women feel wonderful again. So what are the procedures? Okay, what are the procedures that I do at the moment? I will divide into non-surgical procedures and also surgical procedures. Non-surgical, we have the laser here, which I will explain to you in a bit. And some minor surgical procedures I do labiaplasty, hymenoplasty, vaginoplasty, and perineoplasty, and also SCARLESS hysterectomy, SCARLESS surgery. So first, I will introduce. You have to familiarize you all with the anatomy. Okay, how the female external genitalia looks like. Okay, we start with this. This area is called the perineum. Okay, this whole area we call it the female perineum. So the top part is the clitoris, and then the labia. Okay, the labia are the lips. The labia is divided into two. One is the inner lips, the outer lips. So what I usually operate on is the inner lips. I don't usually do the outer lips. Then this is urethra. This is where the urine comes out. This opening is where the urine comes out. And then this is the vaginal opening. And around this is the hymen. Okay, this is a very thin membrane. It is called the hymen. And this perineum here, this area is very, very important. Okay, what you see here is the skin, but behind this, there is a very important structure called the perineal body, where all the muscles of the pelvis, it meets there. Okay, so this area is very important and it is easily damaged during childbirth. And this is where you pass feces, the anus. Okay, so there are three openings here, and then all these important structures here. This is the anatomy of the female perineum. So please try to remember, but in between I will repeat this figure. Okay, this is the side view. This is the side view of the female pelvis. This is the uterus, the most important structure here, the uterus. This is the vagina. This is the urine bladder. Okay, this is where the urine comes out. It's called the urethra. Okay, where the urine comes out. And then this is the rectum. This is where the pass motion. This is the opening. And this is the perineum. Earlier we saw, okay, where all the muscles meet, the perineal body. Okay, this area, very important area. This is the opening of the vagina. This is all side view. Okay, so ladies, as you can see, this one, there's a bone here, there's a bone here. All these are all supported by soft tissue. Okay, that means all the ligaments and the muscles only. Okay, so that is why for ladies, it's easy for the structures to come down. So I'll start with the first type of treatment, which is laser. There are basically two types of laser. One is YAG laser and one is carbon dioxide laser. What we have here is carbon dioxide laser. So from some history, it started in Italy. Carbon dioxide laser, they started using around 2008. It was initially used for vaginal tightening. Okay, but you can also use this for surgery. And also GSM. GSM is basically genitourinary syndrome of menopause. Basically, it's about vaginal dryness and all these problems with vaginal dryness after menopause. And sometimes you can see laser people promote for urinary symptoms also. Those ladies who cannot control their bladder, those ladies who, like, when they want to pass urine, they have to run to the washroom. Quickly they have to go. Or those who cough, when they cough, there's urine come out. That is called stress urinary incontinence. This, basically, there are not much studies about this, but it is studies have not proven it to be very useful. But for very minor symptoms, for very minor symptoms, sometimes laser treatment might work for urgency and also stress incontinence. But there are a lot of studies for genitourinary syndrome of menopause or vaginal atrophy. Okay, why? I will show you some diagrams. I'll explain in a while. So this procedure, it is done as an outpatient procedure. Okay, you don't have to admit and all that. We have our own room where you can come, you can make an appointment, you come, and this procedure, it takes about 15 minutes. It does not require any anesthesia, it does not require any painkiller. Okay, there's no downtime. That means after doing the procedure, basically we advise after 1 week to tahan a bit, 1 week. After 1 week, can have sexual intercourse. Very minimum pain or some discomfort. So far, when I do this procedure, those ladies say it's like some end bite or some little bit of burning sensation. Okay, especially when it comes out. And if you go to centers who perform this thing, they have very minimum complications. So what does this laser do? How does it work? What does it do? This laser basically promotes the thickening and lubrication of the vaginal by rejuvenating the vaginal cells. It basically promotes thickening and lubrication. And also studies have shown that it counts after doing this, the bacteria inside the vagina, that's the good bacteria also increases the count, especially for postmenopausal women, those who have menopause. So this one prevents infection. So that's why this one is basically good for those who are menopause. It prevents dryness and also the tightening. Also, it is good for tightening the vagina. So you can see the structure. This is the one before treatment, and after treatment, you see all these cells all are dry. And then after treated with the vaginal, after treated with the laser, this layer becomes thickened. Okay. This is called the vaginal mucosa. It becomes thickened. So when this one gets thickened, the cells, all these cells are here. These cells are responsible to secrete, to produce all the mucus kind of thing, basically lubricants lah. Okay, so make the vagina feel softer, smoother. Okay, a bit more slimy. So and also this thickens the vaginal wall. And the muscles also get strengthened, shrunk a bit. So that is how the vagina gets tighter. Okay. So as you can see, this is real pictures. They take biopsy of the vagina and they compare. So I will show you a short video. Okay, how this is done. Okay, the laser machine we have is called a Belladonna. All right. So this short video I show you. Okay, this is the probe. This is the probe, and this will shoot the laser. Okay, so what we do is we put the laser all the way inside the vagina, and we just rotate. Okay, as you can see here, we just go all the way inside. We rotate, then we pull it out. We rotate again. Okay, we do this process. So as you do, okay, the muscle, this area gets thick and it gets shrunken, the muscles there. Okay, this one is the laser also can use for whitening, but I don't usually do this procedure. Second thing is, okay, that's about laser, which is non-invasive. Second, I will go on to those surgical procedures, more invasive procedures. First, I talk about labiaplasty. Okay, so again, revision. The labia is the inner lips and outer lips. So what I do is I repair the inner lips, the softer, thinner inner lips. So labia, two parts, labia majora, labia minora, the inner one. So sometimes some ladies, there will be enlargement of the labia. Okay, why it happens, I'm not sure. Sometimes it's because of age. Sometimes I see young ladies also, the labia is a bit enlarged, long, irregular. Sometimes it is irregular in shape. One will be big size, one will be smaller. So it does not look good. Okay, so these ladies after shower, when they look, they're not happy with the appearance basically. Okay, and then, but sometimes also this labia, it comes in the way during when they pass urine. Okay, the long labia, it will be stuck together and it covers where the urine comes out. So the urine also, it doesn't come out smoothly. It will like splatter everywhere sometimes when they pass urine. Okay, this one some patients have complained to me. And also it comes in the way during when they have intercourse. Okay, and also some women, they feel discomfort, they don't feel comfortable when they are walking, especially when this labia comes in between. So basically it does not look good and it does not feel good also. So as you can see here, this is an example where one side is normal, one side is, you see, like this, enlarged, very, very irregular. Okay, this is quite common. And this is a picture of all the various types also. This is the normal one, usually very symmetric. This one, you see, sometimes one side is big, one side is small, one side will be longer, sometimes both will be longer, irregular shape, sometimes it will be dark colored. Okay, due to some pigmentation, it will be dark colored. So they're not happy with the appearance. So what we do is, this procedure is a simple procedure. Okay, what we do is, this also is done as a day case procedure, don't need much full anesthesia. What I usually do is I give some local anesthesia. Okay, I inject some local anesthesia, and then I cut accordingly, make sure that both sides are the same, and then we just stitch back with very fine sutures. Very fine sutures we use to stitch the skin back. And it takes about, say, about 45 minutes to 1 hour, the procedure. And after the procedure, I give some antibiotics, I give some medication, some flavin or something, make sure they put the thing on the pad, and I will see them back after 1 week. Okay, most important is to keep the hygiene clean, keep the area clean, maintain the hygiene, and also make sure the area doesn't get infected. So after 1 week, usually the skin, if it's taken care of properly, it will heal within 1 week. So if you're interested, please contact me. I can explain again about this procedure, and we can get it done. So that is about labiaplasty. The next is hymenoplasty. Okay, hymenoplasty is basically repair of the hymen. Okay, sometimes some women, during their run age, they somehow things happen, and one thing after the other, they will have intercourse, and the hymen gets torn. Okay, but hymen doesn't necessarily get torn only during intercourse. Sometimes those ladies who undergo rigorous exercise, stretching, or those who do martial arts and all that, vigorous stretching and all that also can tear the hymen. Okay, so just not only sexual intercourse. So hymenoplasty is a procedure which we do to become virgin again. Okay, to feel good again, because some societies they will insist on the lady to be a virgin, and before getting married want to bleed again and all that. So for that reason, we can help them. So this procedure is also done under local anesthesia. Okay, we admit to the ward. It's a day case procedure, same like the labiaplasty. We admit, and then what I do is I inject also anesthesia, local anesthesia around the hymen. Okay, but before that, before doing all this, you have to see me in the clinic for an assessment. Okay, I have to assess everything first. Then I give you a date to do the procedure, and then clean everything, clean the perineum, that area, we clean it, inject the local anesthesia. We just do some trimming, make everything look nice, make sure the edges are smooth, and we suture back, also using very fine sutures. Now at this age, sometimes difficult to see the sutures, so needle drop also difficult. So, but then somehow we can do it, and usually this one also, it heals in like 1 week or so, 1 or 2 weeks. It heal well, and we can also do emergency hymenoplasty. Okay, just in case you're going to get married, like in 1 or 2 days or so, we can do some. We can help you. We can do a procedure to make sure that when you have intercourse, that you will bleed. Okay, so we can do a planned one before you get married, and also emergency one also we can do. So basically, this is the hymen. Hymen, there are many types. Okay, this is the normal one. Okay, normal ring, there's one opening. Some women, they have this sieve, right? Cribriform. Okay, there are many small holes. Some they have some in between, some septae, that means some extra tissue which separates. This is all because they are born this way. And sometimes, occasionally we see imperfect hymen. That means there's no hole in the hymen. Okay, this one I will tell you about it in a bit. There's no hole in the hymen. And this is how torn or parus, that means somebody who has given birth, look like. Okay, there is still remnants of a hymen. Sometimes they are just tags only, but it will be taut, it will be ragged. If those who have delivered many children, it will be very difficult to repair. But basically, what we repair are those who have just had intercourse, not delivered ones. Okay. So this is a typical appearance of torn hymen. What we do is we inject anesthesia here. Okay, we just trim the surface and we suture back. So we make it as nice as possible. Okay, make it look good. So that is about hymenoplasty. Okay, repair back the hymen to be virgin again. So hymenectomy is a procedure where we cut the hymen. Okay, as I said earlier, there are some girls who are born without a hole in the hymen, without an opening. So there's no opening. So what happens is when they reach the age, when they time for them to have menses, suddenly they will have pain. Okay, pain abdomen, but there's no bleeding. So they will have pain for a few months. Suddenly they'll feel a lump in the lower abdomen. They suddenly, because all the accumulated blood in the vagina. Okay, recently I saw a lady, a small girl who had this problem. Every month, few days they'll have pain and the pain will disappear, but they'll have the lump gets bigger. So when we scan, we can see a huge cyst kind of thing there, one huge thing. Sometimes they have difficulty in passing urine, passing motion. So this one is sort of an emergency. So this procedure, because they are still young, we do it under anesthesia. Okay, this is a hymen without a opening. Occasionally we see like this. So typical appearance is there's no opening and all this bluish discoloration. This is basically stale blood accumulated. Okay, so what we do is put under anesthesia, clean this area. We just make a cut. Okay, we just cut open and drain all the blood which is accumulated, and we create an opening. So after that they have a normal menses. So occasionally this kind of thing happens. So this is actually just for your knowledge. I'm just telling you there's something like this. So we repair the hymen doesn't mean we just make them virgin again. We also cut the hymen for emergency procedure like this. Okay, that is about the hymen. Next, tightening. Vaginoplasty and perineoplasty. Okay. So this one is a procedure where we repair of the vagina and perineum. Okay, so vagina, this area, and the perineum, as I told you, this area, this important structure here. So this procedure is done to tighten, okay, to look good and feel good. Okay, sometimes when we after delivery of few children, this part doesn't look very good. Sometimes when we examine the lady, you can see the opening. The place is quite wide because maybe due to damage during the delivery, and sometimes you can see the inside part of the vagina. Okay, normally you can't see, but these ladies you can see. So that is one thing. It doesn't look good. Then it doesn't feel good also because it is quite loose. So when they have intercourse, either they are not satisfied or the partner not satisfied. Okay, so not comfortable during sex. So either the partner not satisfied, or sometimes some women they find a new partner. Okay, or a younger partner. Okay, never know. Life has to go on. So we can help them. Okay, we can help them improve their life. That is what our work is, to make women feel wonderful again. So we do this surgery. Okay, as you can see here, sometimes when we examine this part, this is the perineum. These are the muscles, and this area is called the perineal body. Okay, this part gets damaged, and the space. Sometimes we have seen also this opening here. This is where they pass motion, the anus, and this opening. Sometimes this area, usually it's about 2 to 3 cm, but sometimes it can be paper thin. Okay, it will be so thin. So usually we measure for us urogynecology. We have those certain measurements. We measure this area. Sometimes it's like paper thin. That means this place is damaged. Okay, so it needs to be repaired. So what we do is this procedure usually it is a bit painful, but can be done as a day case. I have done a few as a day case. Lady come admitted in the morning. You don't have to give full anesthesia. They can opt for full anesthesia or half anesthesia. Okay, half anesthesia or spinal anesthesia. What we do is we clean this area after anesthesia. We clean this area, and then we make an incision. We repair the muscles and then we repair the vagina, okay, and make it smaller, tighter. Basically, the opening gets smaller. But most important is to repair the muscles also and make the opening smaller. So this procedure, after this procedure, this one takes longer time to heal. But before that, we have to counsel properly, lah. One thing is it takes longer time to heal. It may take about 1 month to 6 weeks. That depends on individual. Some people pain threshold is less. Some people they have a higher pain threshold. Basically, the pain is outside, where we put the suture here. Usually, this is the most painful area. Okay, because this procedure is not only we do for just for loosening. Even when I do the prolapse surgery, when the uterus come down prolapse surgery, also I do this procedure. Okay, because this procedure is done, we strengthen this area. Sometimes when we strengthen this area, the structures inside automatically it gets pulled up because the muscles and all get strengthened. So this is not only to look good, to feel good, and functionally also. Okay, we make this these structures here stronger. So that is 2 reasons. So after procedure, we ask them to have intercourse slowly. Sometimes there may be some pain. Sometimes when they sit also, it's not like as loose as before. So when they sit down, they may feel some discomfort, some pain. We counsel all that before doing the procedure. But majority of the women, after doing it, they feel better. Okay, that is about vaginal tightening. But when we tighten, we can loosen also. Okay, we can do this procedure. Some women, okay, I've seen sometimes what happen is some women, they have a very small opening or the small opening or the opening is tight. Excuse me. Usually either they are born with a smaller opening or previous surgery or from trauma or something like that, which cause the opening to become smaller, or sometimes partner too big lah. Okay, so actually I have managed one lady. Okay, one lady who had this problem. This one is very interesting. But before we do the procedure, we must make sure the vaginal length is normal. Okay, sometimes if they are born with small opening and the vaginal inside the vaginal length is short or vagina is not present, then we cannot do this procedure. So very important for assessment. So this one, this lady came because the opening was small. Okay, they couldn't perform, couldn't have intercourse. So I had done this procedure, and after like 8 months, 9 months, she came back pregnant. Wow, that was very, very happy lah. But unfortunately, I ended up in a miscarriage. But I was happy that after doing the procedure, they could have intercourse and she could conceive. So sometimes this procedure can help, the vaginal loosening procedure. So what we do is basically the opposite of tightening. The vagina is too small, so we cut this area. But this procedure must be done very carefully because the bowel and the opening of the rectum and all that is just there. Okay, so we have to do very carefully. We cannot cut too much. We just make sure that at least it is 2 finger loose lah. That is my finger lah. 2 finger loose. Usually we can, when we do, maybe we can insert only 1 finger. After the procedure, we make sure we can insert at least a bit more than 2 fingers into the vagina, and then we suture back and all that. And after that, we try to teach them how to do sexual intercourse. Ask them to basically ask the lady to be on top so that she can control. It won't be too painful. Okay, that is about vaginal procedures. Next, SCARLESS surgery. Hysterectomy. Hysterectomy is a procedure where we remove the uterus or the womb. It is one of the commonest procedures done by gynecologists all over the world. There are many indications, so many indications for hysterectomy. One of the commonest indication, there will be if the bleeding is uncontrolled. We try all kinds of things, but they still keep bleeding. Sometimes the uterus, they just give us the the impression that they want to come out. Or sometimes there can be some growth in the uterus. The most commonest growth is fibroids. Okay, 1 in 4 ladies have fibroids. Then other common things which I see is a uterine prolapse. Okay, that is my specialty. So I see a lot of prolapse where the uterus comes down. Sometimes there can be some ovarian cysts, then some endometrium. The inside part of the uterus may be abnormal. Okay, some problem with that, and many more. So many indications for hysterectomy. So hysterectomy can basically be done by abdominal route. That means we put under anesthesia, cut the abdomen. Okay, either we cut the abdomen and open up the abdomen and take out the uterus. That is one method. Some people do it laparoscopically, keyhole surgery. These are smaller uterus, or sometimes with fibroids also can be done. There are some techniques. They do keyhole surgery and vaginal hysterectomy. Okay, this one, vaginal, is the SCARLESS hysterectomy. So as you can see here, laparotomy means cutting the abdomen. Either we cut like this. This is normally cesarean section also, they cut like this, transverse. Or sometimes if the uterus is too big or there's too big cyst, we have to open up. We need more space, so we cut like this. Okay. Laparoscopy means we put small incision, 5 to 10 millimeter, about 1 centimeter. Some people use single port. They make a 2 centimeter incision, put all the instruments in one place. Okay. So it depends on what they are comfortable with. But the uterus either comes out through the vagina, or sometimes they cut into small piece, morcellate it out. Okay, so there are a few methods. Or the third method, you don't see anything here. Only everything is from down. Nobody knows that the uterus is out, or nobody knows the surgery has. So that is the SCARLESS hysterectomy. So this procedure is done vaginally from down. We make an incision. We give anesthesia first. The good part is half anesthesia enough. Can do under spinal anesthesia. Vagina is cut, and then the surgery is done from down. Uterus is removed. The scar is not. Then we do all the procedures. This one, there are few procedures. After we take out the uterus, we push up the bladder, we push up everything. We stitch back the vagina, make sure it doesn't come down. Okay, and also we do the tightening. So everything is done one shot. And nowadays, mostly done for pelvic organ prolapse, those with the uterus coming down. And it can also be done by other conditions like endometrial hyperplasia, where if the endometrium, the inside bleeding part of the uterus, is some problem there, or small fibroids or adenomyosis and all that. Okay, all the indications except for cancer cases. Okay, cancer, we try not to do this kind of surgery. So vaginal hysterectomy, SCARLESS, advantages, SCARLESS, short hospital stay. Sometimes I admit them in the morning. I do the surgery in the morning. They come fasting, admit in the morning, do the surgery in the morning. And then overnight hospital stay. The next day, if they can pass urine, everything okay, not much pain, they can go back. So it is just a short stay in the hospital, just overnight only. Very much less pain. As I told you earlier, the pain is usually at where the lower part is, the skin of the vaginal opening. Usually the pain is there. Done under spinal anesthesia. So the lady is conscious, but we give some medication to sleep. Very fast recovery. And also, as I said, we do the tightening also together. So to make sure all the structures stay well there. And it is comparatively cheaper. This procedure is comparatively cheaper. So as you can see here, this is the SCARLESS hysterectomy. So this is pelvic organ prolapse. What happens is the uterus falls down, goes down from the normal situation. Okay, as you can see, this is very bad prolapse where the uterus is the cervix, everything is coming out. So this is another one. Sometimes when we examine, this is normal, and you can see the cervix coming out, the lower end of the uterus. This one coming out. So the procedure, it is done under spinal. We give the anesthesia. The anesthetist gives the anesthesia. Okay, we position. Okay, we use this stirrups and all that. We position, and then we pull the cervix, make incision here, and slowly take out uterus out. Okay, and then we suture back everything inside. No, nothing done on the skin. So finally, and also the good part of vaginal hysterectomy is I can sit down and do the surgery, relax and do. Only thing is my assistants, they will suffer a bit lah, because they have to retract, they have to pull and all that. So there will be some discomfort back. So as summary, cosmetic gynecology. So basically these procedures, as I said, is for looking good and feeling good. Okay, it improves a lady's self-esteem. Sometimes after doing this, they feel more confident. These procedures, as I mentioned, includes laser, labiaplasty, hymenoplasty, vaginoplasty, and perineoplasty, and also includes the SCARLESS surgery, the procedure to remove the uterus. So those who need hysterectomy doesn't mean they have to go through the normal way. They have an option of taking out from down. So certain people have the skill to do that. So again, we make women feel wonderful again. So to feel wonderful again, you can contact me through this Erufu site. Details will be given. Thank you very much. Thank you very much for listening to me. I hope you enjoyed the talk. I hope you learned something. I hope you share with your friends this information so that they also have the knowledge and can come and see me for treatment. So thank you very much. If you have any questions.
Okay, thank you, Dr. Anil, and thanks to those that are still with us. Now we actually open the sessions for the question and answer. Do drop us a question in the comment box. I will get Dr. Anil to answer all your questions. Okay, while we are waiting, actually I have some questions that I would like to ask Dr. Anil. As there is a plastic surgeon also doing all these cosmetic gynecology procedure. So what is the difference between gynae doctors and plastic surgeon actually running the procedure? Patients know, like how we going to choose on that?
Oh, okay. I don't think there's much difference lah, but plastic also trained to do this procedure. We are also trained to do, but not all gynecologists. I don't think all gynecologists do this procedure, just certain gynecologists, but I think most of the plastic surgeons can do this kind of procedures lah. So it is up to the individual women who they want to go and see. No?
Oh, okay. So this is considered a subspecialty, is it?
It's
for a gynae doctor.
It is not like a subspecialty. It's how we are trained, Certain not everybody are trained to do all the procedures, Even I have my own experience. Certain cases I don't do, like cancer cases and all that, So,
Yep.
so it all depends on the training, basically.
Okay, since Dr. touched about the labiaplasty, so probably women will worry that there will be a scarring. So will there be a scarring of the labiaplasty procedure?
Okay, this one also, it depends on individual, So how you take care of the wound after the procedure. I advised earlier, we have to, I give you some medication, some antibiotics, and then make sure that you take care of the hygiene, make sure you don't get infected. But sometimes some ladies, they are prone to keloid formation, So, but then I feel the labia, it is there's no skin, It is the mucosa. So usually that area is usually spared. So if you take care, it'll heal quite well, the result is quite good.
Okay. So my next question is actually who actually would be suitable candidate, right, for doing this vaginoplasty and or labiaplasty, or whom might not be suitable? Probably is not a suitable candidate.
Question, So basically, as you follow my talk, you see what we do is we tighten the perineum. All these occurs due to childbirth. When the baby's head come out, sometimes baby nowadays they deliver very big babies, so there is damage to the muscles there. So the most important thing is I advise these ladies is, or I make sure that they are not keen to get pregnant anymore. Okay. So these are done for
Mm,
more older ladies. Okay. Or if they want to get pregnant, I will tell them that if they want to go for vaginal delivery, then the
mm,
area will get damaged again, lah, you know. So
yep.
they have to take the risk. So it's better to do a cesarean section. So that is very, very important. That is the most important condition.
So this kind of surgery actually, like for example, diabetes patients lady, is it they still can proceed with this procedure?
Can diabetes, no problem. Okay, those diabetics, we make sure they can.
Sugar level high
I
control.
I only don't all these vaginal procedures, even the SCARLESS and all that. I only worry about one thing: those who have heart problem, you know, those who have heart problem, those who are like very important blood thinners, like warfarin and all that. Those who are dependent on that. This kind of ladies, I don't operate lah, you know. But those who are fit, those who walk into my clinic without any problem, high blood pressure and other problems, these ladies no problem. Those, or if I have any doubt, I refer to the anesthetist first. You know, anesthetist, if they give me the green light, for me no problem, I can do it. Okay, I think there's some
Oh,
questions.
yep. There's a questions from the floor. Is that Eating is saying, is there a limitations to perform
Hymenoplasty.
hymenoplasty?
Okay, as I said earlier, what I do is you have to see me. I have to assess first. So usually those hymenoplasty, so far what hymenoplasty I've done are ladies who have not given birth yet. Okay, those who have had intercourse but have not given birth. So as I showed the figure earlier, the whole vaginal opening is not as big. Those who have delivered and all that, usually the hymen is very ragged, and then it just may be difficult to find. So that is the only limitation lah, Otherwise, those who have just not given birth, I think so far I had no problem. Can
Okay. So there's next person, Mei. Yeah. She's asking, is it safe? Is there any side effect? I'm not sure which procedure she's talking about, or maybe a general one that she is asking.
Okay, every surgery, okay, every surgery, minor or major surgery, any surgery, there can have complications, can end up in complications. But we will, it is important for us to assess first, okay, and then we will counsel, we will inform you about the procedure, we will inform you the possible complications, and then we will take our own precautions to prevent complications from happening. And also after that, you have to take care and we follow up. So as you said, we don't know which procedure she's talking about, but so far, touch wood, things have been good,
Okay. So back to my prep question. Also, can vaginoplasty or posterior vagina to be combined with other procedures? Since doctor just now, to make woman wonderful, can actually be a few things that we can do. So it's all the procedure can be doing together at the same time.
Yeah, we can combine. So because sometimes some women, what happen is when they come and approach me, these ladies are usually above 40s already, Once you all reach above 40s, sometimes there will be other complications after you have few children. You may have some urinary problems when you cough, urine comes out, or other problems. So while doing this, we can perform other small minor surgery, like besides the tightening, maybe if you have leak urine when you cough, I can put a sling. Okay, that is another thing. Sling surgery, that is we put a tape underneath where the urine comes out to prevent the leak, or any other small things which should be done, we can do if there's a small vaginal cyst or anything like that. So it's not just limited to just one thing,
Okay.
So
okay.
Assessment very important before surgery.
Okay. All right. So actually, just now Dr. talk about there's one procedure to do with this perineum. So what is the problem actually associated with this damaged perineum? I mean, any things that if I have a damaged perineum, I'm not doing all these surgical procedures to fix it. So what's actually will happen to a ladies?
Okay, basically the perineum, it can be damaged in few methods lah, few ways lah. Most common is during childbirth. What happens is some people, they may have a traumatic childbirth. That means maybe while delivering baby, the technique is wrong, or suddenly delivered, so there may be extra tear. The area, the muscles may be torn more, or sometimes they have difficulty in delivering, and the obstetrician may use the forceps. Okay, those forceps to pull out help deliver. So usually forceps delivery can cause a bit of damage. So what happens is, as I showed earlier, the perineum, the muscles and the perineum, that one, they get damaged, and it gets released, and sometimes when we examine, it is very thin. So that muscles there is the main muscles which supports all the muscles which supports the pelvis converge there. Okay, there's something called the perineal body. So when that one is damaged, when that one is like damaged, or that one is weak, then after damage it become weak. So all the structures come down lah. Where the rectum comes out, prolapse to the vagina, or sometimes the bladder starts coming down, or the uterus also starts coming down. All this is because of that. So when we do the perineoplasty also, as I said, we will strengthen that one. We suture the muscles together. We make the place thicker. Okay, so that itself
support.
That itself can help lah.
Okay. So we're still waiting more questions from the floor. Oh, there's I think Dr. Sren. Jazrina. Well done, doctor. Thanks for sharing. Refer patient for pelvic floor exercise, yeah? Your colleague, is it?
She is, no. She came and delivered with me. And she is basically, she's a physiotherapist lah, So
I see.
For us urogynecologists, physiotherapists are very important to us lah. Pelvic floor exercise also can strengthen. So after surgery, okay, another thing you can do to help improve the pelvic floor is pelvic floor exercises lah. So I refer to the physiotherapists to teach ladies the proper method to do the pelvic floor exercise. Because a lot of ladies, they think they watch YouTube lah, they read in the internet, they think they're doing the right thing. They won't be targeting the right muscle, So it's a wasted effort. So that is why studies also have shown this. So we refer to the physiotherapists. They are the best people to teach.
Okay. All right. Okay, since doctor talked about the post-surgery thing, so what other patient can do to actually achieve the best result of, let's say, vaginoplasty after post-surgery actually?
Cesarean section. Pardon?
I mean after post-surgery, okay, what doctors advise for patients to do actually achieve the best result? For example, vaginoplasty. Because just now doctor talked about since you talk about the pelvic exercise is one of the ways. So what other things?
So as I said earlier, the best, you have to take care of the post-surgery lah. Immediately after surgery, you have to take care of the wound. Make sure the healing is well. And then long-term thing is, another thing, make sure, I hope that these people don't get pregnant again lah. If they get pregnant, then want to deliver normally, then maybe you have to come back again for a second surgery lah. But the thing is, you must understand, for us, we try to do our best. We assess first lah, the pelvic floor, when even in prolapse and all that. A lot of ladies they come, they say they feel but we assess properly. If we think that it is just a bit only, just sagging a bit, coming down a bit, we tell them that, you know, it is not necessary to do surgery yet, because we must be sure, we must be clear cut. Because sometimes after doing the surgery, the thing repeats, means then you want to do again in that area is a bit difficult, no? Can get very complicated. So that is one thing, proper assessment. Then and then if possible, pelvic floor exercise will help maintain the muscle strength after surgery. Okay, I think one question.
There's one question. The cosmetic surgery are one-off. Will the patient needs to go back for further follow-up or maintenance after a certain period?
Okay, that one, very good question. That one depends what procedure you do. You know, like hymenoplasty, we just repair the hymen temporarily so that, you know, they feel like virgin again. So after intercourse, naturally it gets torn. But like that is hymenoplasty. The vaginoplasty, perineoplasty, it is also usually done only once, and then I will see back usually after 1 week after surgery, then maybe after 1 month, I make sure everything okay, no pain. But those who come for SCARLESS, SCARLESS surgery, PROLAPSE surgery, those ladies I follow up long term, because there's studies have shown there's about nearly 30%, okay, 20 to 30% can recur after the surgery. Okay, that means the prolapse can happen back. Sometimes after we do the surgery, after we take out the uterus and all that, the supports are still weak. If they don't take care, or, you know, sometimes the supports are still weak to handle what the surgery we have done, the bladder will prolapse. Sometimes the vagina also can come down. So we may have to do a repeat procedure. So those for SCARLESS surgery, especially for prolapse and all that, I would advise them to come for long term lah. You know, we also want to make sure. So long term means after like 1 year, maybe we see once a year, 6 months to 1 year, to see if they're okay, can pass urine properly, can pass motion properly, all that lah. Okay, so that.
Let me check, is there any questions? No more. Okay, probably Doctor have the last questions before we end. So just now Doctor talk about the post-surgery advice. So usually, what is the preparations before the surgery? I mean, get a little bit what's to get to the ladies, what they should prepare before they want to proceed with this procedure.
Okay, before surgery, that depends on what type of surgery. So if like I start with the minor ones lah, you know, like the hymenoplasty, the labiaplasty, you know, those I do under anesthesia. So I tell them, you know, I will first assess. Okay, come to my clinic, I assess first, then I give them the date. Maybe they can have a light meal in the morning. This one, because it's not done under full anesthesia, just local only, so can have a light meal, and make sure keep the area and all that clean, the perineum. And then what I will do is during the surgery, I'll again clean and all that, and then do the procedure. So this is for those ladies who are minor procedure lah, no? Then, but those who are going through the SCARLESS surgery, those or like the perineoplasty and all that, those ladies, they have to fast overnight, because we are doing it under anesthesia. So they have to fast overnight. And then sometimes if they have medical problems, we do a blood test. We make sure the blood results are okay. Or those who have like a bit older, say 45 above, 50 above, we also do who have to go under anesthesia. This we have to do further investigation. Sometimes we do chest X-ray. Sometimes we do ECG. You know, all these investigations. This is for us to make sure, and for the anesthetist to make sure that things will be safe during the procedure, during anesthesia. So these are the pre. And also those who are going under spinal anesthesia, half anesthesia, usually the bowel all gets very, very loose, and, you know, so what I do, I prepare the bowel also, you know, the night before, or if they're admitted earlier, the night before and the morning, I'll give some medication to make sure clean all the whatever is in the rectum lah. Okay, So because otherwise during the procedure things can get a bit messy. Another thing is
All right.
they shave all everything like the perineum, unshave the hair and all that lah. You know, all these are the
Oh.
pre-procedure things lah. Pre-procedure prepare the area.
All right. Okay, doctor, there's still one more questions from the floor. Okay, Jeffrey asking, how can as husband to know whether our wife have this issue or only our wife will know it?
Okay.
This is a husband, I think, Jeffrey.
Yes. A friend of mine. Okay.
Oh.
So
good question actually for guys to know on this.
Yes. Sometimes, okay, say like prolapse, okay, this guy a married man, so like prolapse, maybe, or if the perineum is loose and all that, no, when they have intercourse, they feel different, you know, they feel like it is loose, not like before, or if it's loose lah, you know, or if like prolapse, when they have intercourse, suddenly they feel they feel they're touching something, maybe they're touching the cervix or something coming in the way, you know, so that is how the husband may feel, you know, or sometimes, but again, sometimes the wife lah, it all depends on the wife to inform the husband also, you know, that they are having this kind of problem. So only if it clearly shows, maybe the husband will know lah. But seriously, honestly, until now, only the wife have come and told me lah. You know, only patient come and tell me the problem lah. So far, husband hasn't come and approach me and say, "Oh, my wife got prolapse," you know, unless it's you know, unless it's like very obvious.
All right. Okay, thanks, doctor, for your today sharing, and thanks to all the friends that are actually still with us. Please do click a like on our page and also like on our video, and do help us to share around today's live so that more people can benefit from it. So before and end, I would like to inform that we have a break this Wednesday. Please join us back next Monday. We'll have a talk for couple solution, making your dream into reality through assisted reproductive technology by Dr. Tan Chi Ho. And on next Wednesday, we have Dr. Chui Yu How to talk about diabetes management in the Mandarin sessions. For more information, please check out the announcement post on the Care FB page. The right clinic, the right doctor, the right care, the right information, the right knowledge. No panic, stay at home. Good night, Dr. Anil.
Okay, thank you very much. Good night.
Good night, everyone. Bye-bye.
Okay.